Hello. No. People can't hear me, can they? You can. Oh, okay. Okay. Good afternoon, everyone. My name's Jenny Sams and I'm facilitating this session on Indigenous homelessness and our experience in COVID-19. And probably this time we can talk about a relatively positive experience. I'd like to open by acknowledging traditional owners of the many lands upon which we're meeting. I'm on the land of the Wurundjeri people, and I'd like to pay my respects to elders past, present and emerging, and acknowledge the land has never been ceded. Thank you for coming, and I'd like to particularly welcome our special guest from New Zealand, or Aotearoa, and I'm sure I haven't got the pronunciation 100% right, but I do my best. Thank you very much and welcome, Ma. So this session is about the policy response in Australia and overseas to tackling the impact of the pandemic in Indigenous communities. We've got a very good panel with various experiences, and I think there's a lot to learn and to take forward. We want to understand the international response for First Nations people, what countries have responded well, what's not been done so well, and what are the lessons for the future, which is absolutely critical to our thinking and how we go forward. Have the rapid policy responses created opportunities for greater innovation in governments and their relationships with Indigenous communities? Have the responses enabled communities, and how can we take that forward? So our three panellists today are Ma Hetaraka, Kyllie, Cripps and Darren Smith. I'll do a brief introduction of each one before they speak. We'll go through each of the presentations and then come back to the discussion forum. So I look forward to your comments, your questions, your challenges, your debate. It's all what it's about. So Ma, if we can start with you, thank you very much for joining us. It's very exciting. I learned a lot about Maori housing when I went to the Maori Housing Conference in 2016. So I'm all ears for more. I understand you looked at the Canadian model of housing first, altered it for New Zealand as you would, learned a lot through the process, and when lockdown ended, also had the experience of what can be held on to and what not, and how we've got to work, I think, to maintain the gains, so to speak. So thank you very much, Ma. We'll go to you.
Tēnā koutou katoa, a katauri te manga ko waikato te awa ka tānui te waka. Ko pohara me werero te marae ko Ngāti Kuriki kahukura me Ngāti Taonga te hapu. Ko tānui waikato te iwi. Ko Marama Hetaraka tōku ingoa. Nō reira, kia ora mai tātou katoa. My name is Marama Hetaraka. I'm the Operations Manager for Social Housing here at Kāhui to Kaha. We're a Ngāti Whātua iwi, so in Australian terms we're a mob. And I've been working here for the last 2.5 years, but I've been working in the social service sector for the last 25. Kāhui to Kaha, we work from a values-based model of practice, and that's all around te ao Māori values-based. We're a mental health organisation who got into social housing as a result of understanding and realising that a lot of those that we work with within the mental health sector had a lot of social housing need, and so we moved into social housing as a result of that. We started out in social housing as part of the Auckland Housing First Collective, and then not long after that received our community housing provider status, and so today provide a whole spectrum of different housing needs. We were asked as a part of the Housing First Collective to get into emergency housing, and so when our Prime Minister announced that Aotearoa was going into a level 4 lockdown, the day after we were asked if we would move into emergency housing. more so because of the homelessness population we serve. The next day, well, that evening we started housing, and so that's how we ended up working in emergency housing with a myriad of different people during the pandemic. And so I can get into more about the response and our learnings from that after we hear from the others. But it's definitely my privilege and my pleasure to be here with you all today. And so, kia ora, Jenny, just, glad to be here and to add my kōrero to the conversation today.
Thank you very much, Mark. Fantastic, and we look forward to hearing more. Can I now turn to Kyllie Cripps? I first came across you, Kyllie, met you in the family violence area. You've got a long record working from academia and elsewhere in Aboriginal social issues and mounting both analysis and responses, I think. So currently a senior lecturer in the law faculty at the University of New South Wales. And I think one of the key things standing out for me is you're going to speak about the strength of the Indigenous community sector in responding to COVID and touch on the shortcomings. So welcome, Kyllie, and thank you very much.
Thanks, Jenny. Yeah, absolutely. And thank you for including me in this panel. I've been doing research in the domestic and family violence and child protection and sexual assault field for 20 odd plus years, and have been also doing some research in the housing space, thanks to a colleague at the University of Tasmania, Daphne Habibis, a few years ago, who introduced me into this space, and we did a report together for Kāhui that was launched last year. And so as part of looking at the circumstances around housing and the importance of housing, we have certainly understood the importance of it in the context of COVID and what it means in terms of how do you do the planning around the circumstances around COVID when housing is in short supply. So part of the conversation I want to have today is to reflect on the circumstances of housing and the planning around housing and what that looks like, and also to look at what has Australia done well in this year, looking at what have we learned a lot about in terms of how we acted quite fast in terms of mobilising our community sector, our community controlled sector, to direct policy, to direct actions to protect our community, and how the voices of our community were heard in these important times. To make sure that our communities were protected and safe, and certainly moving forward, thinking about what are our learnings and what can we do in terms of ensuring that we draw lessons from data, and making sure that we draw strengths from that data and understandings around intersectionality as well. So I'll talk more about that in a few moments. Thank you.
Okay, we'll talk to Darren Smith. Darren Smith. Darren's the CEO of Aboriginal Housing Victoria, an organisation of which I've been closely involved as the CEO at one time. Darren, you're going to talk more about the experience in Victoria, and I think, you know, while Victoria had the harshest lockdown just about in the world, debatably, the impact on Aboriginal communities in terms of the pandemic was very well managed, as it turned out. Maybe it's luck, maybe it was good management. Darren, can you talk to us a bit more about what we've learnt, the strengths and weaknesses?
Sure. Thanks, Jenny. For those of you that don't know me, my mob's from the Trail-Woolaway in northeast Tassie. And can I start by acknowledging and paying respects to country, traditional owners and elders from across the country. I'm on the lands of the Wurundjeri people, and can I acknowledge and pay respects to their elders and their elders past, present and emerging. For those of you who don't know Aboriginal Housing Victoria is the only registered housing agency in Victoria. I'll just give you a little bit more information about AHV. So in Victoria, there's a number of other smaller Aboriginal housing providers across Victoria. AHV itself's got a strong history of advocacy since the 1980s in the delivery of housing services since around 2010, and it recently reached the aspiration of the founding elders with the title transfer of 1,448 properties to AHV, which is part of the reason that Jenny and I know each other well, because we're both involved in that, and Jenny was the CEO at the time. What I'd like to talk about is my observations from a housing perspective of the COVID-19 response from the Aboriginal community, and to talk about the broader Aboriginal response, and then about housing homelessness response, which should make sense as I go through. Jenny, just for clarification, do you want me to go through this now, or did you want to come back to me? Was that a yes?
Yes.
Yeah. Yeah. Okay. So I think for context, it's important to remember that parts of Victoria, particularly Gippsland, were subject to bushfires just before the pandemic struck. So a lot of the Aboriginal organisations were already well connected to the emergency responses. So and were actively involved in part of that emergency response. And from very early on, Aboriginal community organisations were very conscious of the health risks to the Aboriginal community, but also to the risks of reducing face-to-face services for vulnerable clients, as well as part of the pandemic response. So Aboriginal organisations advocated very strongly to government to ensure that the Aboriginal community wasn't overlooked in terms of government response to the pandemic, and to ensure that Aboriginal organisations were resourced to respond appropriately and responsively to community needs. In Victoria, there's an Aboriginal Executive Council, which is made up of statewide and peak Aboriginal organisations, and pretty early on, that body provided a bit of a coordinating role in terms of ensuring that we were across issues and making sure that we were actually advocating into government about government's response. And because Aboriginal organisations were on the front foot, they were able to respond and adapt early to the different ways of working that were required under the COVID restrictions, and in order to ensure the safety of families and communities. And part of that was moving from the face-to-face service delivery interactions and moving to telephone and internet-based services, coupled with regular client check-ins and welfare checks. And in Victoria, most organisations moved fairly rapidly from working from the office to working pretty much all staff working from home. So that's where we all ended up in June, July. But even earlier on, most organisations only had a few staff in the office. So in terms of that, there were some key mechanisms that were created with government. So there was an Aboriginal Community COVID-19 task force, which there were a number of Aboriginal community organisations on that task force, and it was led by our Premier's Department and DHS and Justice departments, and included a range of other departments, including education. So they were meeting on a fortnightly basis, and that was critical to providing clear communication between what's coming up from communities and what was coming out from government, because in Victoria, there was a hell of a lot of information coming out of government departments. And one of the challenges was actually being able to find the specific set of information that related to the delivery of your specific services. So and that was critical to be able to move from advice to action. So in terms of the communications outwards as well, there's a pretty early on, it was identified by Aboriginal community organisations that there were risks around how families were responding and if the messages were reaching through to the families. So there's quite clear communication back into government about having a set of consistent messages that could be sent out through a range of networks to communities to address the risk and to ensure that there's some way of actually responding to some of the poorer behaviours that were going on. So, you know, early on, you know, there was the issue that young people in particular weren't getting the message, and it wasn't reaching them in language that they were able to engage with. And there's also issues, particularly around families, around when there were restrictions on visitors in houses, that first of all, the message had to get through to people, but, you know, the reality is that it also created social isolation in some of the families as well, because you know, it's not the norm in Aboriginal families that you cut your family members out of visiting. So so DPC developed a set of clear communications, and that was picked up and adapted and sent out by all the community organisations, some of them tailoring their messages. The government provided a range of funding streams, which allowed organisations to adapt their services. So that was critical in terms of making sure that those community services could actually move from the face-to-face delivery models to more of a telephone and internet-based services. In particular, there was a 24-hour counselling service that was initiated during this period, run by the Victorian Aboriginal Health Service. And, you know, I'm aware that in terms of family violence and legal services and support for those support services associated with vulnerable families involved in child protection, there's a whole range of adaptations, and also the health services as well. So again, that level of communication into government meant that some of those issues around access to PPEs and masks and things like that, and just even hand sanitizer early on, organisations had a way of actually accessing those kind of resources to support their services as well. In terms of another example is the issue with the towers. I don't know how many of you are aware of this, but the public housing towers in Victoria, a number of them went into lockdown for a period of time where the residents weren't allowed to leave the towers at all. There's a number of Aboriginal tenants across those towers, and a range of Aboriginal services took on the role of actually supporting those clients in those services. So there was, you know, there's a need for brochures to be provided to the tenants. There's a threshold issue about confidentiality and access to, so they couldn't actually contact them by phone, because in order to contact them by phone, the public housing had to actually get the consent of the tenants to provide their information. So there's a whole range of activities that organisations took up the challenge and made sure that their services were available and were on the ground in terms of accessing the towers to support the tenants. In relation to housing services, there's a whole range of things that we had to do in order to adapt our services. So, you know, we moved from having home visits to having telephone check-ins and welfare checks on clients. We provided a 1-800 free call number to make it easier for tenants to access our support during that time. There was a ban on maintenance at a point in time, so only urgent repairs were allowed to be conducted for quite a while. So we had to communicate to our tenants. We didn't get to be honest, we didn't get an extreme reaction from tenants, because when we did contact tenants, a number of them really weren't interested in having people coming to their houses because they were concerned about the health risks. So, but we also had to back that up by, creating a database of requests for non-urgent repairs that we can come back to and work through later in time. In Victoria, we saw a huge increase in the number of Aboriginal clients in hotels, in temporary accommodation. It was, I think, around 100% increase on the numbers last year. Pretty early on, Aboriginal organisations had identified that this was a likely outcome of the restrictions on having visitors in the house, and that we expected that because of the high levels of couch surfing and people who were moving from family to family and household to household, that those people were much more likely to not be able to do that because of concerns from families about how that might impact on their health. And I guess the last point I'd like to make is that there's a number of risks that have been identified as we move into recovery that we're all still working on. Some of the funding that was made available to Aboriginal organisations and in the homeless and housing area for Aboriginal community organisations have been slow to come out. So the resources which would, the funding which was to be made available to support tenants and support the passage of people from into the hotel accommodation have only just come out and been made available, which is during the recovery period. But I guess in a way that's a bit understandable given the context of what's all been happening. As part of the recovery period, there's stimulus funding which is coming through housing. So there's 35 million available for Aboriginal community housing across the state for repairs, upgrades and refurbishments. And there's also been a recent announcement about a social housing package. And in addition, there's an announcement of 150 million, which is available to the whole community for homes to homes, which is designed to support the transition of people from hotel accommodation into more secure forms of housing, which is in a combination of private rental accommodation and social housing. And there's tailored support packages available for that. So there's a big question about how all those resources hit the ground in the recovery period. And we know that there's some risks that Aboriginal homelessness might rise. And just for context, the rate of access to homelessness services for Aboriginal people is the highest in the country in Victoria, and it's increasing year on year. So that passage from homelessness services and homelessness into accommodation is supported by some of those bigger government packages, but the question that we all have is, how's that going to work for Aboriginal people?
Start with Kāhui with this one. Jenny Mulcairn's has said in Queensland there's been a huge impact on Aboriginal and Torres Strait Islander communities with the implementation of biosecurity zones, closing off communities affected people who were in major centres for healthcare, a lot of difficulty in getting people back to community, and I've seen a bit of that in Victoria, I must say, plus the available quarantine hotels not being culturally suitable. And I know, Kyllie, you had some comments about hotel quarantine and hotel accommodation. Can I throw to you first, and would you like to talk a little bit more around those issues?
Yeah, absolutely. Thanks, Jenny. Let me start by acknowledging that I'm on the lands of the Gadigal people here on the Eora Nation here in Sydney. and also acknowledging elders past and present, and also acknowledging too the workers that have been working tirelessly in and with our communities, ensuring our health, our safety and our well-being during this particularly tough year with COVID. In terms of housing, there's been a number of challenges, and I acknowledge Jenny's point there around the challenges there in Queensland. And there were quite a number of significant challenges, both in remote contexts as well as in urban contexts. And what I might do is just cover off firstly on some of the positives, and then I'll jump into some of the significant learnings in terms of the challenges. And I suppose some of the positives are that we did learn a lot about how our community comes together and acts fast, particularly our community controlled sector comes together fast to protect our communities, to do what's needed in the moment, to be leaders and to say this is what we need to lock down our communities and to keep people out and to keep our communities safe. The voice of our communities were heard, and the voice was heard in such a way that, you know, when the APY lands, for example, decided that they weren't going to issue permits, this was backed almost immediately by the Commonwealth and by the state in the issuing, as they did in Queensland too, with the backing of the biosecurity zones. That did come with consequences, obviously, in terms of limiting people's movements and then the management of that. And people, you know, these were uncertain times, and trying to manage those kind of circumstances on the hop was a challenge. And I'll get to that in just a minute. The other important thing too that was a positive was that there were a lot of examples of industries and philanthropic organisations coming in to support Indigenous people and communities, offering us goods and services that were needed and appreciated, including biomedical supplies, as well as the offer of available housing to support our communities with the challenges of quarantining in overcrowded conditions, and to also support additional workforce requirements in these circumstances. So, for example, in some parts of the country, the mining councils of Australia had worked with particular mining industries to free up some of the housing available on mining sites to enable the availability of those accommodations for second workforces, for example, to come in as required, and to also enable quarantining of families if that was needed. So the focus, particularly for we had a national Aboriginal and Torres Strait Islander advisory group on COVID, and that had broad representation and inclusion on that task force. And that task force had a very close sitting with the chief health officers at the national level, and was well placed to have the ear of those that were making significant decisions around biosecurity, for example, but also around funding and where things needed to be sent at particular times. That level of governance, that level of being able to talk to those that were making decisions at the time was really important to what took place thereafter. The focus of that group, however, was very much focused on getting remote communities protected. That it missed some significant opportunities for getting the city response right as well. In respect of housing, that meant that there was some significant challenges with the pressures on people to return to community. Before lockdowns took effect, overcrowded communities became even more overcrowded. There was also some significant issues around food and grocery security. This was an issue particularly for those living payday to payday, when Australians across the country were going crazy over grocery items, this also impacted acutely those who didn't have ready access to funds and or transport to get access to food and or grocery items, particularly in regional and remote areas where it's you know, a significant drive into town if there's no groceries there for you to collect. Had COVID hit these communities, it would have been like a bushfire whipping through the community, given the extent of the overcrowding. There would have been little that could have been done to contain an outbreak, to socially distance an individual, let alone an entire household. It thus highlighted yet again that overcrowding needs to be urgently addressed in these settings, with additional rooms built on existing dwellings, as well as new builds for housing stock. Now, this has been an issue that we've been highlighting pre-COVID, and COVID has just highlighted yet again the significance of it. In cities, we faced our own unique challenges dealing with diverse mobile populations. So Indigenous people returning from overseas was one group. Indigenous people who were homeless were also needing to be urgently accommodated and needing to be off the streets. But little thought was being given to the where and how of this, or indeed to what additional supports would be needed to support this transition so that people would want to stay in that accommodation. There were early reports of people being placed in the same hotels as people returning from overseas. And when they attempted to leave to get food because they weren't provided with food, police gave them a tough time, including issuing them with public health fines. Also, little consideration was given to their medical needs and their daily requirements to attend pharmacies to access medications. No assessments were done to consider their additional needs, increasing their vulnerability and the likelihood that the housing options that were offered to them were going to fail. Indigenous prisoners being released early were another population that was in urban environments, and in these circumstances that they were not necessarily released with all the right checks and balances in place to facilitate a smooth transition back into community, which may not have been possible at all in the short term if the community was subject to a lockdown. There was also concern in the early days of their releases. The victims were not notified, causing much stress and anxiety and a rush to organise safety plans, particularly for domestic and family violence victims. There was also, for Indigenous victims and offenders of violence, there was also a need for accommodation for victims, because as we know, many reports that there was an increase of domestic and family violence through the COVID period, and we weren't immune to that. Some states acted on advice from Indigenous community and provided emergency housing to both parties, which was a good thing. Recognising that in the aftermath of violence, victims may not want to be in the family home and offenders may be legally precluded from being there. The availability of temporary accommodation to both parties conceivably alleviated pressure elsewhere within the family and the community, providing housing options in the aftermath of the violence. That being said, though, its implementation into practice was not as effective as it could have been, with some reports that more thoughtful planning was needed to ensure that victims and offenders were not located in close proximity, and to also ensuring that the accommodation offered to mums with children was fit for purpose. A hotel room is not necessarily an ideal situation if there isn't kitchen facilities available for mums with newborns, for example. In the aftermath of the acute phases of COVID, much is still to be learned as to whether the temporary housing accommodation offered in the acute phases of the COVID pandemic will translate into transitional or long-term housing offers, and how quickly. If we're to face a second or third wave of COVID in specific jurisdictions, how quickly we can marshal housing responses to meet everyone's needs. And another important learning too has been the impact of COVID on mental health conditions, with many health services seeing a deterioration in reported conditions over the course of 2020, impacted by lockdowns, access to health services, access to support services, and access to support networks. More attention to this will be needed in the year ahead. Yeah, I'll leave it at that. There's a bit more to say to talk to the other questions, but we'll come back to that.
Thank you, Kyllie. Mark, can we come back to you? And I'm wondering if you can incorporate into next things you might say a question from Brian Duke: how are Indigenous youth supported and what were the challenges in this area? And we can come to others. But one of the things you've said is you took the Canadian model and altered it for the New Zealand context. And of course, Maori structures of family, society, and broader context are so critical. So I'm interested to learn a bit more about your response in that context, and whatever else is relevant, and that question of young people as well, if that's okay.
Cool. We, as an organisation, we very much have all people have a right to housing belief system. That, coupled with a do whatever it takes approach, is what we found to be a really good mix for successful housing. And so that supersedes age, gender, ethnicity. It's just about seeing people as humans. So removing as many barriers and challenges around housing access has been a large part of what worked for us. When we can, especially when we consider the many facets of what occurs when people are traumatized and shamed and are then faced with having to share personal information about themselves. So our stance as an organisation is that people are entitled to keep their own information and then to share information with those they have trust with. So just because we work in a professional setting, it doesn't mean that we have the right to subject anyone to a level of scrutiny before they enter our service. And we have, so just over 50% of the people that we work with identify as Māori, Indigenous to Aotearoa New Zealand. So on the surface, it may not sound too different from other services. However, our indigeneity is about ensuring that we do things that strive to uphold the mana, or the inherent self-worth of those we engage with. So this includes developing systems and support systems that support the belief. And so we shouldn't be insisting that people are going to be jumping through hoops to get service. People come to us with mana, and so they should never lose it while they're working with us. So a part of our approach, a part of what we do in our response, is to make a conscious effort to ensure that we're delivering services from a cultural values base of whanaungatanga, which is about connection, manaakitanga, which is about support, and rangatiratanga, which is really about self-determination. So the lessons that we learned during lockdown was that, humanity has a great way of managing and dealing with a crisis in a crisis situation. So all organisations there in Aotearoa, especially here in Tamaki Makaurau and Auckland, the government, community agencies alike took on a do whatever it takes approach, which meant that we were able to relax some of the constraints around access and accommodation that would usually have been put in place and seen as a barrier for everyone to access it. And so that was including Indigenous young people who came to us. So this approach allowed most of the homeless here in Tamaki Makaurau and Auckland to be housed during that period of lockdown. We also learned that the more that we communicated together, the more that we met, the more we learnt about each other, and that there were more things that drew us together than separated us. So that enabled a greater collaboration between all organisations and produced a level of transparency and honesty that had not been there before. And it wasn't through the centralisation of systems, it was really through the practitioners and the people that were on the ground floor who were doing the mahi, who were doing the work there, and building great connections with those that we were working with, as well as the professionals. So when it came to access like food, it meant that organisations were relaxing their barriers and saying, look, if there was a food need, they would meet the food need. If there was access around benefits and stuff, then they would access them. So people were opening up their doors and seeing people as human beings rather than a system or a thing. A coordinated approach worked well when the focus and the aim was about getting people housed, meeting need, as opposed to meeting systemic or contractual needs. So contracts still needed to be met, systems still needed to be done, but we found that we could complete the administrative process around that retrospectively, just as easily as what they would have, had we done things pre-COVID. But with our young people, they were coming through as well. And so really it was about kind of relaxing those constraints. It was really about organisations working together and making a conscious effort to just make sure that the needs of those people that we were housing were being met. So people were able to just talk to each other. And so there was lots of communication online, lots of communication through telephone around how we were going to make things possible. And people didn't look at, well, we needed to get this done and we needed to get that done. And what about A, B, and C and all the rest of it? People were just looking at people like human beings. It was kind of like, we're all in this pandemic together. No one knows how we operate during this pandemic. So we really just need to band together and just make sure that everyone's looked after. And so it worked really well for us, when we talk about meeting the needs of the Indigenous people of Māori here in Aotearoa. And it kind of went out the window, the constraints that we would normally see. We were able to get health services also meeting the need of people. That took a little bit longer to operationalise other than when we consider that up against food sources and making sure that people were looked after. Yes, it generated lots of conversations, but people are people at the end of the day, and that was pretty much how we did things. I suppose the other thing that we learned is that actually skill mix is really, really important. So we don't typically, as an organisation, concentrate on the qualifications of a person. And so we have people who have hospitality experience, have security experience, who are from air hostesses, who are from airlines, employed in our services, because they're used to dealing with people who are already elevated, who already have challenges that they face. And so we found that actually getting people who were able or just happy to simply just sit and have a talk with someone around what they needed worked best for us. And it's been one of the key points around us being able to deliver what we call successful services. People have stayed engaged longer since COVID, and so we still continue servicing a lot of them at the moment and moving them on to long-term tenancies or permanent housing. So that's been our response, and that's been just some of our learnings that we've had right across the country.
That's a lovely story, thank you, and I'm sure there's all the difficulties. Ma, there was a question which you've sort of answered, but has the New Zealand situation since the beginning of the crisis meant that more people are housed now? And I guess to a degree time will tell. But and I'll go back to Darren after you've finished on that, if that's okay, with the same question.
I can say that from an organisational perspective, yes, more people have been housed in temporary accommodation. And I suppose a large part of having people housed in long-term permanent accommodation is really about the source of housing. And so there is new builds coming through all the time. But those deadlines have also pushed back, COVID has also pushed back a lot of those deadlines. And so we have found ourselves having to hold people a lot longer than expected, but it has definitely increased the people that we've been able to help.
Thank you. And Darren, I'll come back to you, and I'm going to roll a few things up for you. One is any comment on young people, but also a subsequent comment from Brian Duke. Are there differences in support with the New Zealand model and what we have here in Australia? And to put this as a leading question, I think one of the things in Victoria in particular we learned is the strength of the Aboriginal co-op model and the relationship between Aboriginal organisations really helped carry the community through. But I'll leave that to you to sort of answer, really.
Okay. So the first question, young people, I know that AHV doesn't have a direct role in providing support services to young people. So this is more of an observation about what I've seen happening with the other Aboriginal community organisations. And, there's been a lot of concerns about increase in anxiety and mental health, increases in family violence impacting on young people as well. And a number of the services have put in place specific responses to deal with young people, and they've attempted to increase their engagement with those clients. And so I think it's been an issue that everyone's been concerned about. I think some of the additional resources have gone to that servicing. So some of the additional funding from the government, I think also organisations have just found ways to reallocate some of their resources so they can put it into areas that they need to focus on. In relation to the question about what's different, I suspect there's a lot of things different between New Zealand and Victoria. I can't say I'm as familiar with Māori housing in New Zealand, so I can't really answer on that side. What I guess I can say is that, Jenny, I agree with you. It's the strength of the Aboriginal co-op models has been fundamental to the way that the housing and homelessness response during COVID-19 has gone forward, and they have been very active in talking to government about the risks that they see and working hard to make sure that those connections for Aboriginal people in accessing homelessness services, that they're getting the support that they need. To be honest, I think a lot of them are concerned that they haven't, and that there are people that haven't got access to the accommodation during COVID-19 that needed it. And, you know, there's the kind of stories that you hear all the time about people who end up sleeping rough and sleeping on the riverbed. So that's endured during COVID, even though there's been, you know, vast amounts of increased funding to accommodate people, including Aboriginal people. I guess the other context to the issue about housing is that it's pretty much acknowledged in Victoria that there's a lack of social housing supply, and it's an issue that's gone back over about a decade. So we've got market issues with housing in Victoria, there's affordability issues, and it all crunches down at the bottom end because we haven't been building more social housing in Victoria. So that's absolutely contributes to the high rates of Aboriginal homelessness. And we know there's more people, there's 100% more people, Aboriginal people in hotels at the moment than what we're accessing temporary accommodation 12 months ago. And there's a huge concern that if we don't find ways of getting the housing response in the short term, that we may see an increase coming out of COVID, not a decrease.
Thank you. And we're down to our last 2.5 minutes. I think we could go on for another hour. I'm going to set an impossible thing for each of you. In 30 seconds or less, is there anything else you'd like to say? And I'll start with you, Kyllie.
Okay, I think there's two things I want to say real quick, and that is that for lessons for the future must include complete collecting essential data, including data specific to indigeneity, as an essential first step, ensuring its quality and its completeness, as the information is a key driver in identifying and addressing any gaps in our policy and practice responses now and into the future. A further learning is that we must recognise the importance of intersectionality. We have to plan for it so that we can ensure that people's needs are met immediately, not as an afterthought, some days, weeks or months down the track. We know that people's lives are complicated and they intersect on so many levels with race, gender, sex, age, disability, mental health, and these need to be factored in when we look at crises such as COVID. And so it's therefore incumbent upon us to learn from what we did and didn't do so well in responding to intersectionality for the future, so that no one gets left behind or becomes more vulnerable in our rush to apply one-size-fits-all models of care. We need systems of care that leave no one behind or no one more vulnerable. I'll leave it at that.
Yeah, thank you. Mark, literally 30 seconds.
I think a lot of the points that Kyllie raised is definitely relevant for us here in Aotearoa. But I think for the most important issue is that people are people, and we need to stop putting systems or constraints in place that are going to see people as anything different. We need to work in a system that's going to tear down that stuff, that's going to work with Indigenous people and not against them, or shame them, or traumatise them any more than what we've already done.
Thank you. Darren, you're down to 15 seconds. Do you want to say anything?
The importance of self-determination and Aboriginal community organisations in providing local support for Aboriginal communities and Aboriginal people, absolutely fundamental.
Thank you so much. I just think that's fantastic, and it's really a beginning. It'd be nice to have a longer conversation. So thank you very much. It's been a very, very big audience. Some good's come out of all of this amongst all of the I guess, tragedy and hard stuff. So thank you. I really appreciate it. We're down to our last second and we're ending. Thank you very much.
Kia ora.